Council of Asian Pacific Islanders Health Committee's first webinar on immigration reform, health, and the Asian American Pacific Islander community. We really want to thank everyone who took the time to register for this webinar, and want to apologize in advance if anyone is experiencing some technical difficulty issues. But if you are experiencing any technical difficulty issues, there's an option for you to type a message in the chat box, and we'll do our best to remedy that. We just also want to say that this webinar will be recorded and available at a later time, so feel free to just actively participate and not take notes, because you can watch it again and everyone's contact info will be available at the end. So next slide, please. So before we begin, I'd like to just maybe give a big thank you to the Health Committee members who are part of today's webinar. We have Chris Harley from the Association of Asian Pacific Community Health Organizations, Christine from the National Asian Pacific American Women's Forum, and Helen from the Asian American Justice Center, who will actually be talking more in depth about some of the issues that we'll be raising. One of the questions that we asked ourselves about this webinar is, why even have it if we really want to talk about immigration reform? Because I think for most people, when they think of immigration reform, it really just becomes this discussion about a pathway to citizenship or issues related to worker visas or family reunification or other things. But we also need to maybe put some facts out there about how immigrants, both documented and undocumented alike, actually pay into the system to strengthen our economies. A recent study in 2010 showed that undocumented immigrants actually pumped $13 billion in taxes into the economy. And these taxes are actually used to pay for things like public safety, public health, and a lot of federal health services that many of us enjoy. And so I think we just want to put that fact out there. When people think about immigration reform and health, they always think about immigrants using the healthcare system and never paying into it. So we'd like to put that fact out there. The second part is, undocumented immigrants are already excluded from many of the federal health programs that are being debated and talked about. A lot of people think that health benefits and welfare and other pieces are places where undocumented immigrants actually come and take without paying. But again, we just like to say that this work continues to on our side by pushing that under the ACA and a lot of federal health laws, undocumented immigrants actually don't pay into the system. You'll hear from our speakers today about the fact that Congress is actually on the verge of fixing this broken immigration system. And as a coalition of more than 30 groups, the National Coalition Council on Asian Pacific Americans continues to inject many priorities important to the Asian American and Pacific Islander community, with the Health Committee really pushing this issue of fairness in the immigration reform debate when it comes to health programs. And so just to be mindful of time, and I know that I really want to get right into the meat of the discussion, I'd like to introduce our first speaker. So next slide, please. Actually, no, let's go back to the outline. So we're going to be hearing from Helen from AJC to talk about the overview of the comprehensive immigration reform proposal and what's happening right now, followed by Chris from APCHO to talk about the implications around health policy existing and maybe future pieces related to health policy. And then Christine will be talking about the impact on Asian American Pacific Islander women and other vulnerable populations that we see. And we're hoping to have a robust question and answer period at the end of this, so we'll go ahead and get started. So next slide, please. So now I'd like to turn it over to Helen from the Asian American Justice Center.
Thanks, Paulo. As Paulo mentioned, I work at the Asian American Justice Center, or AAJC for short. I'm the Nepal Law Foundation Partners and In-Health Council Community Law Fellow. So AAJC was founded in 1991 as a national civil and human rights nonprofit organization. Our mission is to advance the human and civil rights of Asian Americans and to build and promote a fair and equitable society for all. At AAJC, our health and immigration programs intersect to advance access to health and nutrition support programs for immigrants in the current reform efforts. So to start today, I'm going to provide an overview of the legislative process for comprehensive immigration reform, its timeline, and where we are today. For the first time since 2007, passage of comprehensive immigration reform is viable because of the growth of the immigrant rights movement. The President himself has said that passing immigration reform is a top priority for his administration in his second term. So a national rally for immigration reform was held at the U.S. Capitol on April 10th of this year, with the message that the time is now for comprehensive immigration reform. 6 days later, on April 16th, the bill was introduced in the Senate after months of careful negotiations by a bipartisan group of 8 senators known as the Gang of Eight. The bill is titled the Border Security, Economic Opportunity, and Immigration Modernization Act, also known as Senate Bill 744. I'm sorry, could you go to the next slide for the timeline? Thank you. So the bill is known as Senate Bill 744, or S744 for short. The bill is then referred to the Senate Judiciary Committee for consideration. Committee members had about 3 weeks to submit amendments to the bill by May 7th. A total of 301 amendments were filed, and then the committee went through the bill and its accompanying amendments over the course of 3 weeks, with 5 days, totaling 30 hours of actual formal meeting and debates known as markups. At the end of this committee process, the committee had considered 212 amendments, and eventually 141 were adopted. The bill left the committee with a vote of 13 to 5, including 10 Democrats and 3 Republicans. Next slide, please. Under the bill, there are 3 main titles. Asian Americans have a stake in each of these 3 titles. Our communities are continuously impacted by every facet of our nation's current immigration laws. As the fastest growing minority group in the country, it is projected that the Asian American population will grow to approximately 40 million people by 2050. Nearly 2/3 of Asian Americans are foreign-born. And of the estimated 11.2 million undocumented people in the country, approximately 1 million are of Asian origin. Asians waiting for family visas make up about 40% of the family visa backlog. Our community has a significant stake in this current immigration reform debate. Areas of focus for Asian American communities have been family reunification, a path to citizenship for the undocumented, and interior enforcement, including E-Verify, which is a federal electronic employment eligibility verification system, because of the hugely disproportionate impact on Asian Americans, and because these areas are few in the most need of improvement as the bill moves in Congress. And as our topic in healthcare today will show you, the issue of access to public benefits and the Affordable Care Act is also very important to our communities. Excluding aspiring Americans from federal health and nutrition support programs is contrary to the long-standing American values of fairness and equal opportunity for integration. The reality for all of us is that we may not always be able to plan for periods of economic insecurity. So although on average, only 12.6% of the Asian American and Pacific Islander population live below poverty, the rate is much higher for some Asian subpopulations, such as the Hmong population, which has a 37.8% poverty rate, for Cambodians, which is 29.3%, for Laotians, which is 18.5%, and for the Vietnamese, which is 16.6%. So of the 301 amendments introduced, 20 were related to health insurance and federal health and nutrition programs. During markup of the Senate bill, some positive amendments aim to lift restrictions on when immigrants who are lawfully present can access health and nutrition support programs, while others aim to place further restrictions for immigrants such as those in registered provisional status. As Chris will discuss next in more detail, the fight for access to health care for immigrants is still an uphill battle. But before we get into our health discussion, I'd like to give an overview of the issues in the Senate bill that will impact our communities. The Senate bill continues to set the framework for Congress's comprehensive immigration reform discussions. So understanding the myriad of issues and interests contained in the bill will give context to why health is still an uphill battle for all of us. Under the bill, under family reunification, there are both positive and negative changes proposed for the family immigration system. There are positive provisions to redefine immediate relatives to include spouses and minor children of legal permanent residents, allow an expedited process not subject to American cap, allow parents of U.S. citizens to immigrate to the U.S. to bring their minor children with them, and eliminate the family backlog over a period of 10 years, among many other issues related to family reunification. During the markup process, the bill was amended to fix a problem for Filipino World War II veterans that will now allow them to bring over their adult children. However, AAPI and many other organizations and coalitions, including NCAPA, are extremely concerned about other proposed changes to the family immigration system, which are a dramatic departure of America's tradition of family unity because for two reasons. One, they would eliminate the ability of U.S. citizens to sponsor their brothers and sisters, and two, place a cap on the age of adult married children to be sponsored to 31. So transitioning to a component of comprehensive immigration reform that you've likely heard most about in the media, we are encouraged by the inclusion of the path to citizenship in the Senate bill. As mentioned before, approximately 1.3 million of the 11 undocumented immigrants in the United States are Asian Americans. The bill permits certain undocumented immigrants to seek registered provisional immigrant or RPI status in advance of becoming lawful permanent residents and later citizens. However, the proposed 13-year path will make it extremely difficult for aspiring citizens to eventually naturalize. There are a number of requirements that advocates are concerned that will be insurmountable barriers to naturalizations in the Senate bill that I won't go into detail here, but that you can read about in a written testimony that AAJC submitted before the Senate Judicial Committee hearing on comprehensive immigration reform legislation on April 23, 2013. A link to the testimony is on the Senate Judiciary website and is also provided in the slide. Similarly, we also have concerns about interior enforcement and their implications on individuals' due process rights and the requirement of E-Verify for foreign-born workers. Again, our analysis of these provisions can be found in our Senate written testimony submitted before the hearing in April, and you can access this using the link in this slide. Next slide, please. So where is comprehensive immigration reform today? The Senate bill is expected to move to the floor next week with a vote by the entire Senate by the end of the month before the July 4th recess. In the House, the 8 negotiators working on the bill currently include Sarah, Carter, Johnson, Labrador, Yarmouth, among many other congressional members. And again, this is a bipartisan committee. Negotiations, however, have been held more secretively than those conducted by the Senate Gang of 8. The House group has reported that it plans to release the bill by the first week of June, but it remains unclear whether there will be one comprehensive bill or separate bills addressing different issues in immigration reform. There have been many rumors that negotiations to produce one bipartisan bill have been very tenuous and always on the verge of collapse. The most recent rumor was that Democrats were balking at provisions limiting access to the Affordable Care Act, but that the Republicans were adamant that those provisions needed to remain. So today and for the next few days, Congress is on its Memorial Day recess when congressional members return to their districts. These days are a good time for local groups to approach members in their district to voice their concerns and demands for immigration reform. Next slide, please. So there's still lots of time, well, not that much time, but enough time for us to influence and participate in the shaping of the final bill. Some ways that you can get involved is to join the Asian American Justice Center's Reuniting Families campaign by visiting our website at reunitingfamilies.org. And there's also National AAPI Day of Action for Immigration Reform next week on June 5th at the U.S. Capitol. And the website is standwithfamilies.org.
So this is Chris Harley with APCHO. Actually, the website is www.reunitingfamiliesnow.org, so I want to make sure if there's anybody who's not on the webinar, they can find the right website. So what I wanted to do is now kind of hone in on what's going on regarding health, benefits, and access for immigrants as part of the immigration debate. And, I think that there have been already some conversation about how this is really an important issue, but I think that it helps to reiterate how important this is for the Asian American, Native Hawaiian, and Pacific Islander community. This is an opportunity to expand provisions for health benefits that were excluded from the Affordable Care Act. So I think that a lot of our organizations are continuing to push for amendments and language that would help us achieve the dream of the Affordable Care Act, which is to eliminate uninsured populations across the U.S. I think the second thing is that Asian Americans are the fastest growing immigrant population, which has been stated. And we're talking about 18.2 million immigrants who are currently living in the U.S., which is almost half of all immigrants, according to the 2011 census data. And that there are 1.8 million folks that are currently stuck in backlogs because of the visa system, and approximately a million undocumented folks that are living in the U.S. And all of these individuals are going to be impacted by the decisions that are made regarding the immigration bill and what kind of programs they have access to. Next slide, please. So what you see here is a chart that was produced by our partners at the National Immigration Law Center that provides sort of a guide to the different programs and eligibility options for different types of immigrants living in the United States. So right now, there are 48.4 million Americans who are currently uninsured, nearly half of whom are young and healthy, and who stay uninsured because of the high cost. Right? These are the groups. This is the group that the ACA was attempting to target to expand health access programs for. And part of that population includes both lawfully present immigrants as well as undocumented immigrants. So what you can see is that eligibility for the Affordable Care Act, Medicaid, and other federal means-tested programs like SNAP, which is the food stamps program, TANF, which provides cash support for low-income families, SSI, which provides assistance to folks with disabilities and other ailments, and then the CHIP program, or Children's Health Insurance Program, which provides health care for otherwise uninsured children. So for lawfully present residents, so these are folks that are legal permanent residents or here under visa status. Currently, they are eligible to participate in the Affordable Care Act program. However, they do still experience some barriers in terms of completely accessing the premium tax credits and cost sharing subsidies. They, however, face certain waiting periods, a 5-year waiting period to access these other programs, SNAP, Medicaid, CHIP, TANF, and SSI. So, again, even lawfully present folks, continue to face these kinds of barriers. And there have been exceptions that have been carved out for lawfully present immigrants, such as the DACA youth, or youth that receive lawful presence under the Deferred Action for Childhood Arrivals program that deferred enforcement and deportation proceedings for these youth. They have been excluded from Medicaid and these programs, even though they're considered lawfully present. And then when you look at the undocumented immigrants column, you can see that, for the most part, these folks are ineligible for any of these programs, the only exception being emergency Medicaid. And I think it's really important to note that for undocumented immigrants, they are prohibited from even participating in the health insurance exchanges through the Affordable Care Act, even if they're using their own private monies and not trying to use any subsidies or tax credit support. Next slide. So I just wanted to kind of provide that sort of landscape of where we are now before we look at what the Senate Judiciary markup debate included in terms of the impact on health care. So, I think that Helen mentioned that there were about 200 or so amendments that were considered, but there was a total of about 300 that were initially filed, and so not all of the amendments that were filed were presented and debated during the markup committee sessions. But of those 300 or so amendments, there was a total of about 20 that were specifically related to health care. 17 of the amendments were opposed to or proposed to eliminate or restrict health access for immigrant populations, and only 3 were supportive amendments that tried to expand health care options for immigrant populations. So I think the ones that were the most concern for the health amendments that were attempting to limit and restrict health access included 9 amendments from Senator Sessions, which would have required immigration officials to consider the receipt of certain public assistance programs, usage of those assistance for purposes of determining a public charge, which would have, if it had been accepted as part of the bill, would have severely limited the ability of any person, whether in RPI status or otherwise on the path to citizenship, from being able to obtain those services. Fortunately, the one amendment that was put forward for a vote was rejected by the committee, and then the remaining amendments, because there was a total of 9 that tried to insert this public charge requirement, were not considered by the committee. But there is concern that they could come up on the floor when the full Senate is debating this bill. Another one that we were trying to keep track of is an amendment from Senator Hatch, which sought to expand the 5-year bar, or this 5-year waiting period, to the benefits of the Affordable Care Act. And so this would have meant that anybody who is lawfully present and is attempting to seek services under the Affordable Care Act, they would have been forced to wait another 5 years before being able to do so. This one was not offered for a vote. However, part of the negotiations that are happening now amongst the Gang of 8 is how to address this concern by Senator Hatch. What we were hearing is that apparently Republicans didn't realize that the 5-year bar wasn't applied to the Affordable Care Act, and so there may be some negotiations that are happening now, so we're continuing to be vigilant on that particular amendment. And then the last amendment from Senator Cruz that was of a concern was an amendment to deny anyone who had ever been unlawfully present in the United States from ever being able to participate in federal programs. So fortunately, that one was also rejected by a voice vote, and so we were largely able to avoid amendments being incorporated into the legislation that's now currently heading to the Senate floor from penalizing immigrants for using health services. I also wanted to just talk about the 3 amendments from Senator Hirono that were supportive and attempted to expand healthcare options for immigrant groups. The first one, Hirono 15, was an amendment to expand or restore, actually, Medicaid coverage options for COFA migrants. And these are folks from that fall in the independent territories that are part of the Compact for Free Association. So these are folks from like the Republic of Micronesia and the Republic of Palau and the Marshall Islands, who have a special relationship with the United States, and they were excluded from Medicare in a mistake in 1996, and so this was an amendment to rectify that error, and fortunately that was approved by the committee, and so it has been incorporated in the legislation, and we are hoping that it will remain that way. I need to hurry up. Okay, so I'm going to go a little bit quicker. The other 2 amendments offered by Hirono, one would have eliminated the 5-year bar in the current law, and ensure that Medicaid coverage for lawfully present immigrants and adults and children and pregnant women who are otherwise eligible would be able to continue to remain eligible for Medicaid services. And then the last amendment, which was a do no harm amendment, attempted to count time in the registered provisional status as counting towards 5-year bar, so that once those folks transitioned into lawful permanent residency, they wouldn't have to wait any longer to access the federal programs that they're eligible for, and to allow folks to keep their current insurance coverage. Both of those two amendments were debated and then withdrawn from consideration, and it's likely that they will come up on the Senate floor vote. Next slide, please. So I think that what we can see is that there's obviously a difference of opinion between the types of amendments that are being offered. We think that this debate around health care, especially a 5-year bar being applied towards the Affordable Care Act, will come up again in the Senate, and that we're, again, tracking the negotiations that are currently happening sort of behind closed doors by the Gang of 8 who are trying to secure the support of certain legislators that they think are necessary for ensuring passage of the bill overall. At the same time, we're continuing to work with Senator Hirono and other offices that are aware that the gaps in healthcare coverage for immigrants is something that is, warrants additional provisions to try to reach. So, you know, I think that what I keep saying is that it's neither assured that these healthcare provisions will not be included in the legislation, and it's also not certain that they would be excluded. So, you know, we have to remain vigilant. And then I think that, you know, again, the next phase of attention that needs to go is to the House of Representatives. You know, there's, as Helen mentioned, there's been some reporting that the healthcare component of the House legislation continues to cause some trouble. Unfortunately, Nancy Pelosi, the House Minority Leader, issued a statement that, you know, no access to subsidies in the Affordable Care Act, no access to Medicaid. That's always been our position. So we're working really hard to make sure that folks in the House are questioning that statement and recognizing that there is a lot of cost benefits to making sure that immigrants have access to health care, as well as, you know, just sort of general rights and fairness that Paulo mentioned. Okay, I have 4 minutes left. Next slide, please. So I think that, you know, what I'll just say here is that the concern that comes out of these conversations is whether or not we create a two-tiered system of health that perpetuates disparities that will negatively impact immigrant populations. And we know that, you know, already foreign-born members of our communities experience higher health disparities for preventable diseases, and that, you know, making sure that everybody has access to preventative and primary health care is the #1 way to address our individual and public health care, as well as ensure that, you know, immigrants are able to contribute as, you know, tax-paying entrepreneurs and small business owners and other engines of the economy that not having health care would make more difficult. Next slide. I'm actually just going to say, you know, obviously the NCAPA Health Committee, we have, you know, always been supportive of eliminating the 5-year bar and increasing eligibility for programs that are needed by immigrant populations. And so, you know, the longer we continue to exclude folks, the more expensive it becomes, and we will continue to push that message forward as the debates continue. And the last slide, I just want to point folks that actually right now APTRA has a petition to support immigrant health access that is targeted towards our federal legislators, and so you can visit our website at aptra.org/actionalert to sign on to that petition.
Thanks, Chris. And I'm going to shift some gears. I'm Christine Pokis with the National Asian Pacific American Women's Forum. And I'm going to talk about how the current immigration policy reform debate and the health policies within, or lack thereof, impact certain communities particularly Asian American and Pacific Islander women. Next slide, please. So first, why women? Immigrant women make up over half of all immigrants, yet our concerns are largely being left out of the migration debate. In 2011, over 51% of all foreign-born individuals in the U.S. and 55% of all people obtaining a green card were women. Women also comprised 48% of all refugee arrivals, 49% of all people granted asylum, and 54% of all people who naturalized to become U.S. citizens. More immigrants are women and Asian than ever before. Since 2008, more people have moved to the United States from Asia than any other region of the world. Immigrant women are the backbones of our families, communities, and electorate. And immigrant women drive the citizenship process in their families and also make key economic and health care decisions for their families. Furthermore, Asian American and Pacific Islander immigrant women have historically been targeted for exclusion in immigration. For example, the Page Act of 1875, and it was put into place to keep so-called, quote, immoral Chinese women, unquote, out of the country. And during this current immigration debate, while we have made some gains, the concerns and voices of women are largely being left out. For example, a merit-based system would favor men, STEM visas favor men, and in many countries, access to higher education, especially secondary education for advanced STEM degrees, science, technology, engineering, and math, are disproportionately available to men. And alternatively, immigrant women disproportionately work in the informal sector as domestic workers, maids, nannies, garment workers. And women working in the sector have little to no access to employment-based health insurance and are barred from accessing public health insurance. Next slide, please. So in terms of health, many immigrant women will be left out without access to affordable and quality health care. As the bill is currently written in the Senate, an undocumented immigrant woman coming forward to obtain citizenship is barred from means-tested federal benefits like Medicaid for the minimum 10-year waiting period while she is a registered provisional immigrant, or RPI status. In addition to this 10-year restriction, she would also face an additional 5-year wait under current law. And that makes a 15-year wait to go without access to health care. Additionally, as a registered provisional immigrant, a woman would be ineligible for premium tax credits and subsidies in the health insurance marketplaces, placing these new health plans out of reach for many immigrant women. Next slide, please. So Asian American and Pacific Islander women already face health disparities, and lack of access to affordable health care will exacerbate these existing disparities. For example, immigrant women have high rates of cervical cancer, and Vietnamese women have the highest rate of cervical cancer of any ethnicity. Immigrant women also have high rates of heart disease. AAPI women face linguistic and cultural barriers to accessing accurate information and reproductive health care. Studies show that AAPI women have high rates of unintended pregnancy and low rates of contraception use. AAPI women are less likely to visit doctors for well-woman visits and preventative care due to lack of access of health insurance. For example, 29% of AAPI women have not had a mammogram in the past 2 years, and 24% of AAPI women have not had a Pap test in the past 3 years. So access to affordable health care and preventative care can address so many of these disparities. Health coverage for immigrant women can mean the difference between preventing and managing a treatable condition or facing barriers to care, having those conditions exacerbated while going undetected and untreated. For example, while Asian women have high rates of cervical cancer, it's a condition that can be detected with a Pap smear and with early detection can be managed. However, waiting 15 years for health care, by the time that immigrant women get tested and diagnosed, the stage of cervical cancer would likely be advanced and difficult to treat, not to mention expensive. So for a woman with undiagnosed breast cancer or cervical cancer, 15 years can be the difference between life and death. And this lack of health care coverage is largely why women often forego medical treatment and preventative care. And even when they do seek treatment, they face a significant financial burden when it comes to paying for that care. And if a woman isn't well, she can't get the health care she needs, and it's difficult for her to take care of her family. Next slide, please. I also just wanted to briefly point out that the LGBTQ community also faces specific health barriers and disparities that may be exacerbated for individuals that are undocumented or lawfully present within the 5-year bar waiting period. Undocumented immigrants and LGBT folks are more likely to lack sufficient health insurance coverage compared to the general population. And you can find more information on this with the Center for American Progress's report called Living in Dual Shadows, LGBT Undocumented Immigrants, that you can find on their website at americanprogress.org. Next slide. So Chris already mentioned this, and I just want to briefly go over it again. Major solutions to this would be to lift the 5-year ban on Medicaid and federally tested benefits, and also allow immigrants to buy into the Affordable Care Act exchanges with tax benefits. Immigrants entering the registered provisional status and other paths of citizenship will be paying taxes, so they should have the same access to support for which they are eligible. Next slide. So I just want to briefly mention all the ways you can get involved that Helen and Chris have already mentioned. Meet with your legislators. Legislators are home right now, so it's a perfect time for you to visit your legislator in district, attend a town hall, or schedule a meeting to talk about why it's important for you that healthcare access be included in immigration reform, to call, write, tweet your legislators, because they do listen to all the forms of ways that constituents contact them. Also, to share your stories. There are many blogs and Tumblrs that folks are sharing their stories with, including AAJC's story collection. And then there's a DocuAsian, Meet My Immigrant Mom through the We Belong Together campaign, This Asian American Life. And if you're in DC, there is going to be a big day of action, June 5th, and it is standwithfamiliesnow.org. And from here, I think we can open up to questions if there are any questions on the line.
Yeah, Paula, do you want to provide instructions on how folks can ask questions?
Yeah, sure. So there are 2 ways to ask questions. One is in your chat box, feel free to type in your question, and I can share it with all the organizers and panelists to route that to the proper question. And if you do actually have audio enabled on your phone or on your computer, please raise your hand, and I can unmute you, and you can answer or you can ask your question. So I'll go ahead and give people maybe a minute to think about a question and start typing it in. But I like to start the discussion by saying, in terms of the Asian American Pacific Islander community, what do you think is the most, and this is to the panelists, the most pressing issue regarding immigration and health, other than access to the ACA?
Well, this is Chris, and I think that there obviously is a really big concern if there's any traction around the public charge issue, because what that would mean is that anybody who is either determined to potentially need access to federally means-tested programs like Medicaid or TANF or SNAP, if that determination is made by immigration officials that there are opportunities to continue on the pathway to citizenship would essentially stop, right? Because having a public charge is one way in which the citizenship application can be denied. So I think that actually is a really big concern that we're going to have to continue to pay attention to and try to defeat as the legislation is being debated on the floor of the Senate and if something like that comes up again in the House. Otherwise I think that, the 5-year bar is something that our communities have continued to focus on and really just feel like, once folks are paying taxes and are contributing to our economy and are lawfully present, there really shouldn't be these arbitrary waiting periods and barriers that are put up because it just, increases strain on the individual families as well as the providers who are trying to care for them. I don't know. I have nods, so.
Great, thanks, Chris. So it looks like no one has asked any questions or raised their hands, but maybe I could use this as an opportunity to maybe just talk about the National Council of Asian Pacific Americans while waiting for questions. So NCAPA is a membership-driven organization of close to 30 national Asian American Pacific Islander groups that really work to elevate the concerns of the Asian Pacific American community to federal lawmakers, federal agencies, and other policymakers here in Washington, D.C. We do our work through a lot of grassroots advocacy, calls to action, educational sessions like this webinar. And for the Health Committee, we're actually co-chaired by the Asian Pacific Islander American Health Forum and the National Asian Pacific American Women's Forum, both here in D.C., but for the Health Forum, we're headquartered in San Francisco. And so if you do have any questions after this webinar and you didn't have time to get to ask it, feel free to send all of us an email. My co-chair, Christine's email is right up there, so we'll be able to route them. And if we can't find answers for you right away, we are connected to a lot of affiliate partners, as Chris had mentioned, like the National Immigration Law Center and other immigrant advocacy groups that make up the Healthy New American campaign. So,
Paulo, can I just say one more thing?
Sure.
For our listeners, I also just wanted to emphasize, how important these debates really are. When you look at and I think that, the access to healthcare is really part and parcel in terms of how accessible and how readily folks will be able to move along this transitional path that's being proposed by the Senate, right? That undocumented immigrants, would have to go into this provisional status, which is just a way for them to come out of the shadows and have some sort of documentation. But that's a 10-year period right now. Thousands of dollars in fees, requirements of paying back taxes, fines for being undocumented in some capacity, and only after 10 years, then they have the option of applying for citizenship. And there's two parts of this. One, if there are barriers along that way, or if there's not support for these folks to actually be able to jump that hurdle from undocumented status to RPI status to citizenship status, that 10 years can last indefinitely. First of all, is one consideration, and then the second thing is that in terms of then access to health care, going from undocumented status to RPI status, and the way that the legislation is currently written, they would then still be forced to wait that 5-year waiting period before accessing Medicaid and other benefit programs. So again, depending on how long folks are actually able to transition and how well they're able to transition from undocumented to RPI status, and then from RPI status to citizenship status, we're looking at 15 years or longer for the majority of folks that are going to be trying to go through this route. So, again, I think that there's a real consideration of fairness, as well as a consideration of just, sort of generally, the well-being of the folks that might be in this process. And, you think about a child who is undocumented and is facing these kinds of barriers. I mean, they're already grown up before they would be able to access some health programs. And so, that I think is just something that we should be mindful of, because it's that, I guess, the accessibility of the pathway, as well as the ability for folks to jump through the hoops that are being set up, that are going to determine, the time frame for how quickly these barriers start to fall away.
Great, thank you, Chris. And so with that, I don't see any other questions on our piece, and it looks like we are ready to end our webinar. But I'd just like to thank all of the panelists for their expertise and insight today. Helen at AAJC, Chris at APJO, Christine at NAPOF, and for their commitment to really helping advance immigrant and health issues as we move forward in this debate. So just a word just to end it. We're continuing to work very closely with one of our Senate champions, Senator Mazie Hirono from Hawaii, who continues to carry a lot of the progressive family and health and integration values as a member of the Senate Judiciary Committee. So now that this debate enters the full Senate, we're going to closely watch for several amendments that are both pro and anti-immigrant health. Again, Senator Hirono's insight as being the only immigrant elected to the Senate is actually really useful for us as we continue to move forward in this hopefully very productive and great session in the immigration debate as it continues this summer. So this webinar will be recorded, and we will be posting it on our website, National Council of Asian Pacific Americans. And you can visit us at NCAPA online. And again, for all the different organizations presented here, we will go ahead and push resources out to all of you. And there is actually a question about whether or not they'll be receiving a copy of this PowerPoint. And yes, we can email this PowerPoint if you email one of us. Christine, can I make you the point of contact since your email is still up there?
Yeah, definitely. Okay,
great. Thanks, everyone. And we hope that you will join us for our next NCAPA Health Committee webinar scheduled tentatively for the end of June. Thanks again.
Thank you. Thank you.